I'm Dr. Mark LaFave. I'm a urologist here at Wayne Memorial Hospital. I work with Wayne Urologic Associates. People with a family history of prostate cancer probably ought to start screening at the age of 45. That's a recommendation not from me, that's a recommendation from the American Cancer Society and the American College of Surgeons and the AUA. If you do not have a family history, or you are not an African American male, which is another risk group, then 50 is generally when people start screening for prostate cancer. Men oftentimes don't come voluntarily to a urologist. They often get dragged in by their wives, rightfully so. Screening for prostate cancer is really not very invasive. It's a blood test, and it's a digital rectal exam, which sounds horrible, but most men survive it. And it's once a year, typically. When a 55-year-old man is diagnosed with prostate cancer, I sit down with that patient and discuss all the things that are important to help us decide what is best to do for that patient. Once we decide that he needs to be treated, we stage the cancer. Staging means make sure that the cancer has not spread. If everything in the screening is negative and there's no evidence of spread of prostate cancer, then we discuss the options of treatment, which are radical prostatectomy, removing the prostate, either open or robotically, radiation therapy, and there are different ways to deliver radiation therapy that we go over. In older gentlemen, or gentlemen that we're going to treat less aggressively, we can treat them hormonally by taking away the male hormone. There are medicines that allow us to do that without surgically doing anything to the patient, that allow us to turn the male hormone off, which actually turns off the growth of prostate cancer. 65, 70-year-old gentlemen, some of those men can be watched. And you can always change your mind when you do this active surveillance where you're checking their PSAs and keeping a close eye on them and treat them later. I can't stress to men enough to have a frank, honest conversation with their family physician about prostate cancer screening, especially men with family history, such as myself, where we've lost loved ones to prostate cancer. When you're talking about a cancer that's the most common cancer in men, and a cancer that kills close to 200,000 men a year, and a cancer that we can cure if we find it early, it is not worth the risk of finding it late. If your screen is negative, you have peace of mind. If your screen is positive, you're going to find it early, and you're still going to have peace of mind in the long run. There are men that we screen and we find very bad prostate cancer, but it would have happened anyway. So the ones that benefit are the ones that are screened.